Now, we'll discuss another scenario. A screening test was done for identification of hepatitis B infection among 1,000 adult population working in a factory. This means that total population in this scenario which was screened is 1,000 or 1,000 adults were screened. So we know that screening test can have positive results and it can have negative results. So the screening test was positive in 200 individuals. This means that test is positive in 200. 200 were positive, out of which only 70 were positive for disease on PCR test. When we performed PCR tests, 70 were found diseased. This means 200 were positive, but actually 70 were diseased. Remaining individuals were 800, because total population is 1000. 800 were negative, 200 were positive, while 500 individuals were found absolutely healthy. This means that out of 800, 500 were non-diseased. This is a quite confusing scenario, but once again, I'm telling you, you need to subdivide the scenario. What was total population? 1000. No need to get confused after this type of scenario. Just write positive 200, negative 800. Now draw 2 by 2 table. Formulation of table or drawing of table is same in all cases. There we need diseased, non-diseased. If when confirmed, can have diseased persons. So we can write A, B, C, and D. 200 were positive. Definitely out of 1000, if 200 were positive, 800 were negative. Okay, now let's move towards other lines of scenario. 70 were positive for disease on PCR test out of 200. Okay, this means that 70 were true positive and 130 were false positive. When we subtract 70 with 200, answer is 130. When we add both, our answer should be 200. 200 were positive, but only 70 were diseased. Screening test positive doesn't mean that someone is suffering from disease. 800 were negative, but it doesn't mean that all of these are healthy. People may have disease when we do confirmatory test, and scenario says that 500 individuals were found absolutely healthy. This means that 500 are true negative and 300 people were false negative. Actually, they were having the disease, but as a result of screening test, they were shown healthy. So when we add all of them, our answer is 1000. 200 were positive, 800 were negative. Absolutely healthy means absolutely healthy. True negative. Definitely. Negative screening test means false negative and true negative. Total negative were 800 and true negative were 500. So 300 were false negative. Now, calculate sensitivity, specificity, and predictive value of the screening test. We need to calculate sensitivity. We need to calculate specificity. What is formula of sensitivity? A over A plus C into 100, cause A were true positive and A plus C were diseased. We need to see the percentage of true positive among diseased. So A is 70 and A plus C is 370. We divide 70 with 370 and multiply it by 100. It's 21% sensitive. This screening test is 21% sensitive, cause percentage or number of true positive is less than number of false negative, less than total. So this screening test is 21% sensitive. Now we need to calculate specificity. We need to calculate percentage of true negative among total non-diseased. So true negative is D and non-diseased B. B is false positive. It's non-diseased plus D into 100. D is 500. B plus D is 630. So we'll divide 500 with 630 and multiply it by 100. What will be our answer? 50,000 divided by 630. Our answer will be 88%. This means this screening test yields 88% true negative among non-disease. This test is more specific but less sensitive. Now we need to calculate predictive accuracy. We need to calculate positive predictive value and we need to calculate negative predictive value. Positive predictive value means percentage of true positive among positive. A is true positive, A plus B are positive. How many were true positive? 70 were true positive among 200. So we divide 70 with 200 and multiply it by 100. Our answer is 35%. This means that this test yields only 35% true positive among total positive. What is negative predictive value? This means percentage of true negative among total negative. D is true negative, total negative. C plus D, we need to multiply it by 100. What is D? 500. And C plus D, 800. Then we divide 500 with 800 and multiply it by 100. Answer is 62%. This means that this test yields 62% true negative among total negative, or we can also say that this test yields 38% false negative. So this screening test may not be reliable because it is only 21% sensitive, 88% specific. It yields more negative results, and 35% positive predictive accuracy is 35%, negative predictive accuracy is 62%. So we can change our screening test on the basis of these values. We can change our screening test on the basis of sensitivity, specificity, and predictive accuracy. These are the basic measures that you need to calculate, that you must know. Now we'll summarize the session. What we have learned. We have learned how to draw 2 by 2 table. Remember, two variables are compared. Diseased, here we write non-diseased, here positive and negative. Remember, screening test can be positive, it can be negative, but as it is not confirmatory test, there can be true positives and false positive results. This is A and this is B. And negative means that it can have false negative and true negative. Why we wrote false negative here and true negative there? Because false negative means those who are diseased. True negative means those who are not diseased. Or we can say disease means true positive and false negative. If we compare positive, true positive, false positive, negative, false negative, true negative, but true positive is diseased, false negative is also diseased, and non-diseased who are non-diseased. True negative, definitely they are non-diseased, and false positive. So true negative and false positive, they are non-diseased. Ideal screening test should be sensitive, it should be specific. That's how you can draw 2 by 2 table. Remember this. False negative is always diseased. False positive is always non-diseased. So first you have learned how to draw 2 by 2 table. When we add true positive with false positive, answer should be total positive. When you add false negative with true negative, answer should be total negative. But when you add true positive with false negative, answer is total disease, or total person who are suffering from disease. And when you add false positive and true negative, this means total person who are not suffering from the disease, total non-disease person. What we have calculated, you must remember the formulas. Sensitivity, we have calculated specificity, we have calculated positive predictive value, and we have calculated negative predictive value. What is sensitivity? If it means percentage of true positive among disease. A is true positive, disease are A plus C multiplied by 100. It is always written in percentage. Specificity, percentage of true negatives among non-disease. B plus D are non-disease. You always put true positive or true negative as numerator, and then we'll multiply it by 100. Then positive predictive value, it means that percentage of true positive among total positives. True positive is A, so formula is A over A plus B into 100. Then negative predictive value, percentage of true negative among negative D over C plus D into 100. We have done this calculation. You must know how to interpret this calculation. What is meant by sensitivity? If you know the meaning of sensitivity, formula is very easy. Percentage of true positive among total diseased. You should know the meaning of specificity. You should know meaning of positive predictive value and meaning of negative predictive value. Ideal screening test should be 100% sensitive and 100% specific. If prevalence increases, definitely sensitivity and positive predictive value increases. If prevalence decreases, specificity increases. So they depend on prevalence. If it increases, sensitivity increases and positive predictive value. If prevalence decreases, sensitivity or number of disease decrease. This can be a university MCQ. We have solved various questions in order to understand what is 2 by 2 table, what are various formulas. Students try to memorize the formulas. You just should have the concept regarding sensitivity, regarding specificity. When they increase, what will happen? An ideal screening test should contain specific results. If a test gives sensitive results, specific results, that is ideal. That's why certain tests are obsoleted nowadays, and there are new tests are introduced as screening tests. That's why we say that pap smear is ideal screening test for cervical cancer. Blood sugar random is ideal screening test for diabetes. Tracing of blood pressure or tracking of blood pressure is ideal screening test for diagnosing hypertension. Various new tests are coming and old tests are being obsoleted on the basis of this. This is not maths. This is concept where screening test should be used, why this screening test will be used. So you should know why, where, and when. You should know the timing of test during epidemics, when there are new cases, when the disease has a seasonal trend, or we can say that when the cases of disease are increasing, like dengue cases were increasing from July to December. This is the ideal time to screen dengue cases. Where the cases are coming after environmental surveillance. Why? The test which generates true results can be used as screening tests. So you should remember when, why, where. Some diseases have seasonal trends, so you can't always screen them. This is useless. This is wastage of time and money. You should screen them during their season. But some diseases like hypertension, diabetes, they are chronic, and cancers. They are chronic diseases. You can always screen them. So you can screen them throughout the year. Where the incidence is high, where the cases are coming. Why? You have to target high risk people. Who? You can say that who? Those who are high risk for hypertension, diabetes, middle age, old age are at high risk. Those who have the family history, they are at high risk. So you should screen them. And for cancers like cervical cancer, middle-aged female of low socioeconomic status. They are at high risk, so you should screen them. So remember when, why, where, who. Then you can do screening. After screening, you can do confirmatory test or diagnostic test and confirm the disease. And then you can treat the disease. We do screening for early diagnosis. Early diagnosis is important. When we diagnose early, we will treat the case. When we treat the case as early as possible, complications are limited. To establish an ideal health system, our ideal health system goes for screening. It goes for early diagnosis. In Europe, in developed world, populations are screened. They are screened for various diseases. They are going for prevention. They are emphasizing on prevention and screening. They screen, they prevent, and they prevent the extent of disease. That's why their population is healthy. In countries like Pakistan, there is a problem. We don't have collaborative health system. Our health system is fragile. It is poor. We don't have screening programs. If we have screening programs, they are not run properly. There is lack of fund. There is lack of budget. There is lack of manpower. Mainly, there is lack of will. When there is lack of will, how do we screen? We need to emphasize on screening programs in order to protect, in order to prevent diseases. We need to protect our population. When we see the iceberg, burden is increasing. There are epidemics, there are slow epidemics, and there is transition in developed world from non-communicable to communicable disease. But the problem with developing world is that burden of communicable and non-communicable diseases is increasing. We are facing the problem of both communicable and non-communicable diseases. Why non-communicable diseases are increasing here? Lack of screening. And when we diagnose at later stages. We diagnose during complication, then treatment is almost impossible. We need to conduct research programs. We need to conduct screening programs in order to save our population. Many diseases, if are screened timely, can be prevented. Population can be protected, like typhoid is a growing problem. It spreads to carriers if we screen carriers timely. Cervical cancer is a problem. Hepatitis B, C, they are the biggest problem of Pakistan nowadays. Thyroid is a problem, so we need to screen. Targeted screening and specific screening and high risk screening. We need to target population according to area, according to age, according to gender. Then, when we screen, we need to identify the diseases. When we identify, then we confirm the diseases, then we treat. So, screening. Screening leads towards diagnosis. Diagnosis leads towards treatment. It leads towards early treatment. Early treatment leads towards reduction in complications. Reduction in complication can lead to a decreased mortality. So, screening program is beneficial towards population to reduce the mortality or to reduce the burden. That's all.